Hi, everybody. Welcome to Unite Till oh no, wrong event. Welcome to International Day of Light. It looks like folks are just joining, so we'll give everybody just a minute to jump on, and we'll be back in just a second. Looks like everybody's joining right now. We're still a couple minutes early. All right, well, we're letting everybody join. I just want to say hi and welcome, and thank you so much for being here. Again, we're going to give everybody a few minutes to join, and while we wait, I wanted to share an opportunity to support our work and win some really great prizes. Today, we're auctioning off what we're calling our Brightness Basket. The basket includes a Luke light with a glow buddy flower, one of our Chandler chargers, as well as some amazing handcrafted goods from Honduras. There's delicious coffee. We'll actually get to meet Oscar, who made the coffee, in a little bit. A hand-woven basket from a women's collaborative, and a hand-carved wood box. To enter this auction, you can scan this QR code. Every entry is $5. So one ticket's $5, two tickets 10, three tickets 15. And if you get 4 tickets, you actually will get a bonus. So for $20, you get a bonus 5th ticket, which is always nice. We always like that. We'll pick the winner next week. It does need to be a US address. So you either need to be in the US or you need to have a friend in the US that can accept the package for you. But yeah, so this is the QR code, and we'll put it up again during the event. And yeah, we're just going to give everybody another minute to join. But yeah, we'll talk a little bit more about this, but this is a wonderful way you can join our auction, scan the QR code, and have a chance to win a brightness basket on this International Day of Light. All right. Well, again, thank you everybody for joining us today and coming together to celebrate the International Day of Light. I'm Megan Burney-Rudert, CEO of Unite to Light. And as many of you know, we are dedicated to providing low-cost solar lighting and power to people without electricity. We distribute efficient, durable solar lamps and chargers to expand access to light for students, midwives, those struck by disasters, and those experiencing homelessness. We aim to create a more equitable, safe, and healthier future for all. So today, we are going to start with welcome and intros, which is where we're at right now. And then we'll jump into our research presentation. It's really exciting. We spent a lot of years talking to people using our lights about what they use them for, how they help, what they've learned, and also, of course, how the lights hold up. And you'll actually get to hear some really great stories and some great feedback from the field. Then we'll turn it over to Community Health Partnerships Honduras, so they can tell you about their programs and the amazing work they do. And then last, we'll kind of talk about what's next, and we'll hear directly from people who have been impacted by these lights. We'll also have a Q&A. We do ask that you use the Q&A feature in Zoom if you'd like to ask a question. We'll be monitoring it during the event. We'll try to answer things that are timely when we can. We'll definitely have a more in-depth Q&A at the end. And if there's any questions we don't get to, we'll be following up with everybody next week. And so we'll definitely dive into any answers that we missed today if we don't have enough time. There are a few of us, there are a few of you, not a few of us, there are a few of you that are doing watch parties around the US. So I also want to send a special welcome to all of you. Your host should have information on how to submit questions to us as well. So why are we meeting today? May 16th was proclaimed the International Day of Light by UNESCO in 2018 to mark the anniversary of the first successful laser operation by physicist Theodore Maiman in 1960. Today, we're one of just dozens of organizations around the world that are celebrating. A few examples in Amman, Jordan, they're hosting a presentation on attosecond light pulses for studying electron dynamics. I'm not entirely sure what that means, but those of you who know John Bowers, our founder, you can ask him. I'm sure he does. In Kharkiv, Ukraine, they're holding a science fest exploring the role of light in innovation, technology, and chemistry, ecology, social and economic sciences. And in Guwahati, India, a student group is celebrating by raising awareness about the critical role of light and optical technologies in science and education. But today is more of than a celebration of light as a physics phenomenon. It's a moment to reflect on the way that light can transform lives. Beyond the scientific milestone, the day serves as a global reminder of the vital role that light serves in culture, education, development, and everyday activities. It's a moment to recognize how light can advance equity, empower innovation, and improve daily living for people around the world. Light means access to education after dark. It means safer childbirth, better healthcare, and stronger, more connected communities. So this year, we're celebrating the day by turning our focus to Honduras, where the impact of light is becoming powerfully clear. With our partner at Community Health Partnership Honduras, we've seen firsthand how light and power can change lives, helping workers, students, and families navigate everyday challenges and change their lives and their futures. So I wanted to introduce our speakers today. We're going to start by hearing from Gisela Voskernen. She is one of the board members of Unite to Light and mother of Luke, the namesake of our Luke Light. She'll be presenting research from the field with Erica Braun. Erica is a volunteer and an expert in user experience and design research. In addition to helping us, Erica works across sectors from healthcare to technology and consumer goods. You'll also hear from Eileen Padilla. In this presentation, she's been our boots on the ground in Honduras, and without her, we would not be doing this research. We would not have this for you. She wanted to be here, but it was her son's 16th birthday, so she is rightfully celebrating with her family, but we did want you to hear directly from her. So we'll have a wonderful video that you'll get to hear from her. And then we'll turn it over to Jennifer Smith. Jennifer is the executive director and founder of Community Health Partnership Honduras. And you're going to hear some great stories from her. I also wanted to introduce Kate Stevens. Kate is an intern for Unite to Light. She's really been the backbone of this entire event, pulling it together. We're so grateful to have her. She's going to be running tech and Q&A kind of on the backside. So if you need any questions, we can definitely point them towards her. So thank you, Kate, for all that you've done to make today possible. Before we begin, I do want to take a moment to honor Luke Voskernen. Luke's body left us almost 13 years ago, but his light continues to shine through the work of his mom, Gisela, and the rest of his family, along with all of us. For every Luke light we distribute represents our potential and the opportunity for an individual and a family to shine bright. It really does allow Luke's light to continue to shine through the years. So thank you to Gisela, thank you to the entire Voskernen family. We're so lucky to have you and to have Luke in our lives every day. So whether you're joining as a longtime supporter of Unite to Light or a curious newcomer or someone passionate about global change, thank you for being here. You're a part of this mission. And with that, let's get started. I'm going to welcome Gisela. Thanks, Gisela. You want to take it away?
Yeah. Obviously, I need to start with, I might give every one of the hundreds of thousands of lights that have been distributed in Luke's name. I would take them all back if I could get Luke here. But a decade goes by really fast. And in that time, we have been distributing Luke's lights in his name all over the world and seeing through photographs and our own eyeballs, my own, like Sydney has traveled. For those of you that know us, our family has traveled to Kenya, Peru, Bolivia in Luke's name to deliver these lights. They are tiny but mighty, life-changing, but we never had data to back up our findings. So with the help of Community Health Partnership Honduras, Unite to Light, and Eileen on the ground, and her immeasurable energy, we set out to do a longitudinal study in rural versus urban areas of Honduras, which would not have been possible with without folks you will meet this evening. Hold on a sec, Kate. We've already introduced Jennifer Smith and Erica Brown, but we can turn on a switch at night. Millions of people cannot. They learn to live in darkness. So if you go to the next slide now, we can now, okay. When the sun goes down, they have few choices. They have to spend an exorbitant amount of their meager earnings to see at night, or simply go to bed. Like here we are, we're having watch parties, we're turning on our laptops, we can see all over the world, the day has ended for people. They either have to spend exorbitant amounts of money or they need to just wait for tomorrow's sunrise. When the sun goes down, they have few choices, like I said. When resources are severely limited, buying kerosene or batteries means your child eats less. And if you go to the next slide, if you do light your hut with kerosene or burn ocote, which is the wood in Honduras, your family is breathing noxious fumes. According to the UN development program, when a fuel lamp is used, women and children, I don't know why they didn't measure men, women and children breathe in the amounts of smoke equivalent to smoking 2 packs of cigarettes a day. Fuel-powered light is dangerous, polluting, expensive, and dim. So here you meet Maylin. She suffered severe burns due to fire from an overturned kerosene lamp. In her own voice, she burned herself with a gas lamp at night. She's petrified of doing anything at night without, this was a complete godsend for her. You know, a kerosene lamp fell on her. She was burned. You can still see her scars. Today, she has this lamp in her hand. 200 lights of the over 3,000 lights Community Health Partnership Honduras has distributed in Honduras were hand numbered. I personally took a soldering gun. We tried all kinds of things. We tried magic marker. We tried ways, but it needed to be permanent in remote, muddy villages. So I took a soldering gun and put these very crooked numbers 1 through 200 on the base of this lamp, and worked with Eileen, who was the one who identified community leaders to hand deliver and speak to each of 200 people. We wanted to determine if there was going to be usage and benefit differences in remote rural areas versus in urban areas near cities and electricity. But you'll learn in a minute why we were in cities that were near electricity. Go ahead. We cannot introduce you to 200 people, but this is a collage of all the people that received a light for this research project. Young, old, disabled, sick, healthy, 200 humans who would, without this little gift, not have enormous benefits. And now we want to give you a peek at the rural versus urban locations for this. We wish we could take you with us, because many of you who have donated in the past would feel the before and after of these lights. I think you can turn to the next slide, Kate. The rural areas are, you can press play, and we're going to just play you a little snippet of this long video because I want you to see how remote. Some of these places are an hour by truck, like literally on the bed of a truck, a 4-hour walk up a mountain. They're surviving on subsistence farming. They tend to animals and crops. They live the way you will see here. You know, they don't get very far. Schools are very, very far away. And I'll let it play for a minute. I think when it goes around the corner, if you fast forward, you can see inside these homes. They have no glass for the windows. So even during daylight, they're dark. I mean, this is their attempt to have a little light peek in so that the rain doesn't wet everything that they own. But you would think that, oh, in the day they don't need light inside. In the day they have to do their work outside because it really is dark inside these huts at night. You can go to the next one. or play a little more. This is the home of a girl you will meet a little bit later. Her name is Dania, so I'll leave it with that. Some of the rural regions are way up muddy, muddy mountains. If we had more time, we would show you footage of Jennifer and Eileen's truck adventure, stuck dangling wheels down this ravine as men jumped into the hole and tried to push the truck up one side while I stood on the side of the road watching men pull with the chain on the other. This was not an easy project to complete, to get to these 200 people and to ask them again a year later and again a year later how they were using the light. But in these very remote areas, humans who have never had a light, some of whom have never seen an on-off switch on a thing. Some have a cell phone, but many do not. They could not even tell us. We started the research study by asking them, what do you think you'll do with this light that has an on-off switch? And they couldn't really know how to respond. They'd never had that luxury. They couldn't imagine. So we then separately, back up, yeah. The other 100 were sent or brought to urban areas, which is not our definition of urban in the ways we live that word. These were gang-riddled neighborhoods near a city dump where some can steal light by jerry-rigging the electricity to their homes, but even those that do had constant power outages, constant problems with it, and there are no street lamps. So at night it is super dark. Go ahead to the next one. I fell in love with this little girl, but anyway. This is fairly typical of a home there. You know, they're all little tin shacks stuck very, very, very close to each other. Go to the next one. The neighborhood is called Rivera Hernandez. It was once the most dangerous neighborhood on the planet with the most murders. We were brought there by someone I've grown to care about, who he himself worked tirelessly to help young men dream a way out of this space. He's now seeking asylum in the United States and California. But as he escorted us through these streets, handing out lights to families, we were limited to this street and not that one, for example, this gang versus that gang, never to cross into another one just a block away. I think the next slide might show more of this neighborhood. Maybe not. What is this video? We will find out. Oh, and this is now, this is Eileen. You guys will, Eileen could not be here, like you said, she's celebrating a birthday, but we wanted you to meet her in her own and hear her in her own words. Sorry.
Hello everyone, my name is Eileen Pineda. I am from Honduras and I live in San Pedro Sula. 4 years ago I had the pleasure of meeting Gisela and I also met Jennifer from CHPH. Since then, we have been working together in the distribution of the solar lamps. In 2022, Gisela told me about the impact study to research how the solar light changed the life of the people who live in places without electricity. I like the idea very much because it was an opportunity to explore these communities in my country and bring them such a useful look lamp. It took me about 1 year to collect 200 interviews, 100 in the urban area and 100 in the rural area. The urban area was a squatter settlement in San Pedro Sula. The rural area was a total adventure. I remember that my volunteer Carmen and I used to walk 1 hour to arrive to the first village. It was called San Ramon. Sometimes we walk by foot and sometimes riding a horse. I remember when the leader of the community talked and he said that they feel forgotten people in a forgotten place, but Unite to Light sent people with a look lights to them, so they felt important. I really love the experience of the rural area. people is so humble, so thankful, and they show very, very happy with the lights. The last year, 2024, I had the idea to implement a charging station in order that the people of these communities charge their cell phones. So far, we have implemented 8 charging stations in different communities in 3 different mountains. They are very, very useful, and the people is very happy because they don't have to go far away from their houses to get charged for their cell phones. I'm very thankful. I love Gisela, and I love Unite to Life for all the experience that I get. And I know more about the needs of our people thanks to you.
I'm going to turn the reins over to Erica Brown, who not only designed the questions for this study, but this report and so much more, since she was instrumental in the industrial design of making this light stronger. So here's to you, Erica.
Thank you, Gisela. I just love Eileen. She is just wonderful, and we absolutely could not have done this without her. She and her team covered quite a lot of ground to not only distribute the lights, but to do it in a really structured way. As Gisela mentioned, a unique number was carved into each light, and Eileen and her team created unique posters for each individual that she interviewed. And on the posters was their name and their location, as well as their numbered light. And so this afforded us the opportunity to not only track the light and its durability over time, but the users as well over time. Once the interviews were completed, Gisela and I read through each interview, and from the 200 stories emerged these 6 themes that helped to underscore the value that these little lights would bring. So I'd like to take a moment to dive into each one of these in the following slides. So the importance of household savings was brought up in every single interview. Why? Because 16% of Hondurans live on less than $2 a day. To put that into perspective, a pack of candles can cost 80 cents, and candles become very costly because they don't last. Oftentimes, families in these interviews described a candle lasting maybe 15 minutes and having to go through 3 or 4 a night. If they had the luxury of having a light, replacement batteries for the handheld lights cost roughly $1.60. And so with the new Luke light, families and individuals no longer have to spend a day's worth of income on new batteries and boxes of candles, but instead can use that savings for basic necessities like more protein in their diet, or as Gisela mentioned, more milk for the baby. So before diving into safety, I wanted to point out these are the posters that Eileen created for us. And again, these helped us really understand the person and the numbered light that they received, so that when we went back, again, we could track the use of that individual light with that person in that area of Honduras. So safety was another theme that came up in every single interview. And as Gisela shared earlier, without having the solar light, they were inhaling fumes, and there was a lot of fear around fire starting. So with the solar light, they can breathe easier, they can sleep easier, knowing that their places of business and their homes will be safe for them and their children. They also will be able to leave their homes at night. They're not able to walk outside with a candle. And so having the Luke light and having the ability to hold on to it or wrap it around their neck allows them to carry it when they walk. And so this gives them greater care and confidence when they're walking at night, keeping alert of dangerous animals or dangerous terrain that they might encounter. Home care and child care came up quite a bit. I'd like to just a picture for a moment, changing a poopy diaper in the dark. I cannot. I have a 3-year-old, and I cannot imagine having to have changed his diaper without light. But these moms, like Heidi and Lourdes and Wendy, as well as dads, have had to do that. And they were very grateful to have now received reliable light to not only care safely for their children, but to also be able to do things like cook at a decent hour. A lot of them were having to get up really, really early in the morning or to start cooking dinner at 4 p.m. before the sun went down. They also took a lot of pride and found a lot of importance in having their household clean and organized before the next day. But people like Wendy on the far right, she pointed out that a lot of times this wasn't possible because there just weren't enough hours in the daylight to get all of that work done. Before going to the next slide, I also wanted to call out Heidi. She's the young girl on the left. I found her to be a super mom. She said that when she received the Luke Light, she planned to not only use it to care for her children, but that she was really excited to be able to read to them at night and then to be able to complete her studies for nursing school after they had gone to bed. And with now having a Luke Light, she was able to save money that she would have been spending on candles and other things to put towards paying for nursing school. So she's doing a lot with a little. The importance of furthering and protecting livelihood came up both in the rural and urban areas. Many farmers like Manuel and Armando, who are on the left and at the center of this slide, shared that they would use the light to not only tend to, but to protect their agricultural livelihoods and their animals, because at nighttime they have predators and they have pests that come out. And so they struggle with protecting those livelihoods after dark. People like Jose is not pictured here, but I really wanted to call him out. He spoke about his being able to continue his craft after dark. Jose is a tailor with a pedal-powered sewing machine. He actually sews and fixes things for his neighbors. So an important part of the community for sure. And then the young man on the right, Elvis, I'll quickly chat about him. He paints homes for a living. And so people like Elvis often will be walking home late at night after they've finished their day of work. And so for him and others, they talked about prior to having a Luke Light, they would often drain their phone batteries just to get home safely. Draining of the phone batteries actually came up quite a bit as it related to education. So the students pictured here and others brought up that in order to continue their homework at night or their studies at night, they were often draining the phone batteries of the family's phone in order to do that, or they were not able to do their homework. And in these areas, charging a phone is no easy task. And so with the Luke Light, they now are able to complete their homework at night without draining the family's phone battery. And we know from prior research in other countries that given these solar lights and the ability to complete homework and complete studies, that we often see higher graduation rates, which can transform a life.
Hey, Erica, real quick, before you move on to socialization, you've mentioned charging phone batteries a couple times. And I think for many of us, we're like, oh, you just charge a phone battery, you just plug it in. It's not that big of a deal. But can you, or I don't know, Gisela or Jennifer or somebody give us a little bit more insight? What does it mean for these families when the battery's dead? How do they charge their phones?
They have to walk 4 hours down the mountain to a city and plug in. They try to conserve it as much as humanly possible. Sometimes they have to pay. There are charging stations along the way. Eileen mentioned a bit about creating charging stations, which you'll see a photo of in Jennifer's presentation, because her path forward, her idea is to create these charging stations where community leaders can have a bunch of the chandelier chargers and people don't have to walk very far to plug in a phone to a solar charger. But without that, they really conserve it for an emergency, or they have to walk very far until they find a plug. There is no other alternative. And not everybody has a phone. Many have a phone, but not everybody in the rural areas have a phone. So a community leader, somebody with a bit more financial capacity might have a phone. And certainly that person is not lending it out or letting others use it unless it's an emergency. I mean, the vast majority of them have to find a plug. And if you're closer to the city, well, that's really, maybe you can go to it's not like us. We can't go to a coffee shop and plug in, right? They have to find somebody who will let them use a plug to plug their phone into, or they have to pay somebody to let them charge their phones.
I have nothing to add to that. It's incredibly hard, yes. And I think it touches on this last theme around socialization, which while it's the last of the 6 themes, it is certainly not the least. With having to conserve phone battery, right? That's then less ability to call people, and you're only using it for emergencies, right? But we also heard a lot, especially from Maria, that was the first woman early on in Gisla's first slide, talk about the fears of living in darkness and going to bed early as soon as the sun went down, and oftentimes isolating themselves indoors and just waiting until the sun came up to go back outside. And so with the solar lights, what we read from the interviews and what we've seen is that they are contributing to greater socialization. People are able to now safely walk to a neighbor's house after they get home from work just to visit. They're able to check on family members. There was one gentleman whose mother lived nearby, but up until having a light, he wasn't able to check on her after dark. They also talked about being able to now commune at church and not sit in the dark, and that community leaders would be able to organize at night to now talk about community needs. So we've talked a lot about the people and about how the lights are being used. I also wanted to touch on the second part of the study, which is how did they hold up? Well, they actually held up really well. We designed and engineered the lights to be watertight, dust and mud resistant, and durable. And durable in the sense that the neck, we reinforced the neck so that it wouldn't easily be removed from the base, because once it's removed from the base, it no longer works. So that was one point we really wanted to get right with our engineers. And so after nearly 1,000 days of use, only 11 of the 200 lights were damaged. And so, if you think about it, that's 1,000 days of uninterrupted studies, get-togethers, protected livelihoods, safety, and better yet, savings. I'm going to pass it back to you, Gisela.
If you can go to the next slide. So as Erica touched on it a little bit, I mean, after a decade of distributing lights in many parts of the world, we thought we knew what they were good for. I certainly thought I knew what they were good for. Of course, they save folks money. Of course, they help at night, et cetera, et cetera. Of all the things that we have seen in other places, but we didn't deeply consider what happens with these lights at the top of Maslow's hierarchy of needs. So we had this aha, like no pun intended, light bulb moment, because as Erica touched a little bit, before receiving these lights, many of these communities had no choice but to retreat into darkness after sunset. They just shut down. Their days ended not by choice, but by necessity. Without light, there was no opportunity to
Can you tell, you can go ahead and put your, oops.
No, hold on. There's no opportunity to connect, to simply be together. Then something remarkable happened. With Luke lights came conversations, laughter, came shared moments that would have otherwise been lost to the dark. People gathered, they talked longer, they built friendships, they deepened bonds. Instead of isolation, they had connection, joy. Like I never thought these lights would bring joy. Women told us they could now visit a neighbor, gossip a little bit about their husbands. We had a team of girls that then worried their parents because they said, oh, these lights now help us go flirt with the boys. People were organizing to plan for their future, activate politically. Someone could check, as Erica said, on an elderly family member and just sit and talk. So we want to I want to show you a before and after. This 78-year-old Santos, who's remarkably young looking for his 78 years living in the middle of nowhere, runs a little bodega that he had to shut down at night. Super grateful we were there. he was not quite sure how he'd use the lamp because he stays in at night, right? He has to shut the doors, and I don't want somebody to steal my wares that I sell. But then on the next slide, I'm going to let you hear in his own voice, because it's pretty easy to hear him say todo, which means everything. As he explains, a year later, when I come sit with him, I'm like, well, what did you use the light for? And he's like, everything, everything. So I'll let you hear it in his voice. You can translate your.
Sí,
¿No se acuerda el número? ¿Lo sabemos después? ¿Su nombre?
Santos Epifanio Posadas.
Ok. ¿Y cómo usó la lámpara? O sea, ¿en qué le fue útil?
No, si fue útil para nosotros aquí, fue útil porque en la forma del lugar, ¿verdad? Que no tenemos energía y es un lugar sólido que aquí pues no tenemos ayuda ni de alcalde ni de gobierno, los tienen abandonados.
We don't have help. We're abandoned even by the mayor. There's nobody to help us.
Una lamparita.
Okay.
Lo surtió bastante y le agradecemos la gran voluntad y el aprecio que ha tenido para esta comunidad.
¿Y en qué la usó?
La usé, supongamos, para todo servicio, para todo servicio, para afuera. Hay veces que cuando se vienen los chubascos uno le toca salir.
So we had to shut him off for the interest of time, but he just kept saying todo, todo. I used it for todo. I think I'm now turning on. Let's see. I will now introduce you to my partner in light, partner in crime, partner in getting stuck in the mud. Without Jennifer, I don't know that I would have found a place to turn to after my inability to go back to Haiti for very obvious reasons. So with that, here's a miracle worker from Honduras.
Thank you all. And thank you all for coming to join us tonight. There's a lot of work behind the scenes to put this together. And I'm very, very grateful to Megan and Erica and Gisela and Kate for such an opportunity. They asked me to start by explaining a little bit about what Community Health Partnership is, who we are. My husband and I founded CHPH, as we abbreviate it, 13 years ago. We had been traveling to Honduras on medical brigades with another organization, Cape Cares, for 16 years. And we loved the work, but we were eager to broaden our experience and the scope of our work. We wanted to work in a more collaborative and sustainable arc. And so we started to look around with the help of Honduran friends and colleagues, and we found the perfect place. So now our work is primarily and comes out of the Sierra Lenca Mountains with the indigenous Lenca communities. We work, we're very fortunate to have the trust of these communities. The Lenca are very, very poor. They're pretty much they're still very pure Lenca up in those regions. They're strong, poor, proud communities who prioritize their children. They have a great deal of respect for they understand the climate changes, and they all take a part in trying to the roads, the schools, fire watches, things like that. They're the perfect partners. They're very progressive and eager to do anything they can to help their communities. So we work with the voluntarios. That picture shows you a group of them in Florida, that's where we are based, Florida, Opatoro. And each community elects these advocates, and then you have our clinic nurse there, High Day. So we work with these voluntarios at the roots of the communities all the way up through the municipal health services that cover 4 and now 5 regions. But that's the most important part, is the actual roots of our work. There are no hospitals in all of these regions, no ambulances. The clinics primarily do things like the demographics tracking and vaccinations and mosquito-borne vector tracking, but they don't really have much for medication. They can do some minor lab work, but they don't have the resources. So it doesn't do a lot of good to go to the clinic if you have a real medical problem, because they can't offer you treatment. And it's expensive to get down to the city on a bus to go to the public hospital. We began the first dental program, and that now right there. And now they had no dentists, never had a dentist in those areas. And now they have 5, and we support their work through our annual donations of dental supplies. And now we cover 156 villages that sprawl through these vast regions of the indigenous folks. But we rely on the local nurses and coordinators, regional directors, and our crew there, the voluntarios and health promoters. We don't really have any money, but we subsist on donations from people who are generous enough to support us. But we can work a lot of miracles because we have so many partners, and Unite to Light now is one of our most special partners. But we have partnerships with organizations and nonprofits, institutions, and in the public healthcare system as well, all throughout the country. We are able to get the population healthcare that they need when they have children with cancer, children who need surgeries for club feet, cleft palates, things like that. So we work, everything that we do is through partnerships, and in that way we can lift up communities and individuals together. We had some rough times, as everybody has, when the pandemic started. And at that time, we couldn't travel with teams anymore, obviously. And in that region, there's no vaccinations for 2 years. And so they literally rolled big rocks down at the end of their roads to protect their communities from people coming and going, because it could wipe them out. And during that year, there were back-to-back hurricanes that hit the Sula Valley. It was devastating for such a poor country. And that's the center of their commerce and production. So that was when Unite to Light made a very generous offer to us. They were having trouble shipping to other countries because of the pandemic and the distribution challenges. And we were going to be sending a plane load of supplies down with PPE and medications through our partners. And so they gave us 1,000 lights to start. And that was an amazing gift and the beginning of this journey together. They were particularly valuable, those lights, during that time when everyone was suffering from the effects of the pandemic and the hurricanes. But since then, we've gotten over 3,000 solar lights out across the country. Every one of the voluntarios in at least 2 of the regions have a light, and we've given each of the 16 clinics and some of them are little satellite clinics, but they all have chargers so that people have access to charging their phones, and the clinics are very dark too normally, so the lights are very helpful for the nurses and clinics as well. So we've done a lot of work. We're really happy to be, start there, but now we're in 8 or 9 departments across the country. The departments are like states. And this is one of we make a lot of home visits. I go down 2 or 3 times a year, and with a small team of Honduran doctors, we go up into those regions and do a lot of home visits. And those lights have become such a precious gift on those visits. For one thing, we can see our way through and do, it helps us with patient care, looking at x-rays, reading what maybe little bit of medical reports they might have. And for people who are caring for family members, imagine trying to take care of somebody who's paralyzed, like Pablo. Pablo was shot in the neck by accident, a mistaken identity case, when he was only 24. He is quadriplegic, and you can see he was lying on a chaise lounge that's supported by a cement block. And he had a waterbed mattress, a medical one, that was leaking. So we were the first one to visit him in 7 years. That's our Honduran doctor, Dr. Elsa Lanza. But we were able to replace the mattress and waterbed and get him a proper bed to go underneath it. And but the best gift of all was the light, I think, at least for his mother. She was so thrilled to have a light in her kitchen. Belkis, in the center of this picture, is one of our clinic nurses, and we've been working with her in the clinic for 10 years. She's only 28 years old, but she is suffering from pulmonary fibrosis and needs a double lung transplant. That is not within her reach, and nor is it within ours, because it's such a complicated thing. But we were able to buy her recently an oxygen concentrator, which will save on all of the oxygen that she goes through. And that light is a very precious. The electricity goes out there very frequently, at least 2-3 days a week. So that light is very helpful for her and for her caregivers, her family members. The community distribution has been, this was a really fun, this picture is Las Trancas. This is, sometimes we get to light up an entire village. So Gisela and I were out together in December, and it was really bad. I've never seen the roads so bad, so muddy. But Oscar got us up there. I had to park my own truck. It was impossible. And we got all the way up to Las Trancas, which is one of the more remote areas of Opatoro, and in all this mud. And as we pull in, here comes the local band. They came with their instruments and set everything up. So they played for us. They provided us with a beautiful lunch, and then Oscar had helped to arrange before we went up. There was one member from each family in the community at the church where we had the distribution. And so each family gets a light, and you can see in that picture that's representative of every family in the village. We also we distributed chargers for them. And in cases like this, because rather than having to go to a charging station, each family shares a charger. So 4 families usually to a charger, and that will provide them, the ability to charge their phones. So this is that's Pablo's mother on the left. I don't know if you can see her smile, but she was so happy when Gisela put that light up for her. It was very dark. And she gave us a little demonstration of her ecote use. She had a big stick of it and peeled off a piece and lit it up. So we got treated to the noxious fumes that Gisela spoke about. And on the right-hand side, that's Lillian and Jose Antonio. I am only 5'2", but you can see Lillian is below my shoulder. The Lenca are very small people. One of our doctors referred to them as pocket size or travel size people. They are small, but really mighty people. And they work very, very hard, long days during coffee season picking beans. And so Lillian and Jose were coming home from coffee picking. I gave them their lights to get home with. We have been working with her daughter for 10 years. I met Shaylee when we went up. One of the people in the village told us about her. She was 9 years old. She had club feet. She had never been able to walk. She was climbing up and down the mountain on her hands with no opportunity to go to school. And a very bright child. It's worthy of a book, the story, but she was the first surgical patient that we helped. And that helped us to learn more and more about what we could do. And that little girl has since been to the United States for for critical spinal surgery since as well. She's now 19. I'll be seeing her next week. She's doing really, really well and and she's all the way up into high school education now. So we've had a lot of great stories. And I'm sorry, that's Noe. Noe, I'm sorry, we switched the slides. Do you want? Yep, there. That's Noe. Noe, we were up in Las Brisas with Eileen doing light distribution. It's another community that had no electricity, very, very remote. You had to drive up a couple of mountains to get up there. And there's nothing around these people. That little boy in the middle and with his black t-shirt, and that's him on the left, Noe. We were distributing lights and we brought reading glasses. He tugged at Gisela's arm and confided that he was very scared he was going to go blind. He was already blind in the left eye and he was losing his vision in the right. And they have no clinics, no schools. They don't have anything up there. So what we did is through Eileen, we hired a driver, and paid $50 for someone to go all the way up in get him and bring him down to our partners who deliver eye health care in San Pedro Sula. And so he's been treated there and we're following him, and he's been giving eye drops, which is saving his vision. And we've sent along some protective glasses. But these are the stories. And I have hundreds and hundreds of them where we can make a difference through our partnerships. Unite to Light, in this case, gave us the opportunity to be there and to give that little boy a chance at retaining his vision. And it was amazing. I love to, and especially because it has a kind of a happy ending, and we'll stay on top of that. What's next? We hope a lot more lights. I'm so grateful. Every light has a story. Every light has a person and a family behind it. And while I hope it's powerful for you to hear the stories through our telling, Nothing compares to hearing it like from the people who it directly touches. Their voices and experiences really capture the impact of our work better than I can. And it's why it's so important for us to keep going with this very successful program. So next you're going to meet Oscar, who I referred to earlier. He's our community partner, and he's a coffee farmer, coffee producer of organic coffee. And he is a tremendous community leader, helps us a great deal. And then you're going to meet little Danya. She stole our heart and continues to impress us every day with her progress in school. And tonight we have the chance with your support to change the lives of over 1,000 Danyas. Thank you so much for giving us this opportunity.
Hola a todos, mi nombre es Jenny Alonso. En esta ocasión vamos a hablarles un poco acerca de la importancia que es el proyecto que nuestra amiga Gisela y Jennifer Smith traen a Honduras. Estoy acá junto a mi padre Óscar Omar Alonso y vamos a explicarles un poco acerca de lo que se trata este proyecto para las personas de escasos recursos y de algunas comunidades remotas en donde no hay energía eléctrica.
Buenos días, mi nombre es Óscar Omar Alonso Aguilar, soy el dueño del proyecto Finca Cual Bicicleta, que está ubicado en Chinaclo, La Paz, Honduras, Centroamérica. Está a 1500 metros sobre el nivel del mar. Nos encargamos en las tareas de producir cafés orgánicos, cafés de alta calidad, cafés de perfiles presidenciales y perfiles especiales para diferentes mercados, Estados Unidos, Europa y Asia. Y gracias al rubro del café hemos tenido la oportunidad de conectarnos con la señora Jennifer Smith, que es la directora de la organización de ayuda humanitaria para Honduras en el tema de la salud, CHPH, y Gisela Voss, que es la dueña del proyecto Lucas Light, que son estas lamparitas que se pueden cargar 8 horas en el sol y tiene 8 horas de luz en la noche en esta lamparita. Y esto nos sirve para poder apoyar a diferentes personas en las diferentes comunidades que no tienen energía eléctrica. Y gracias a este proyecto, pues ahora hemos hecho una distribución en las zonas remotas de nuestro departamento, apoyando a diferentes familias. Saludos y muchas gracias por la ayuda. Saludos.
I'm going to interject here for just a minute because I personally fell in love with Danya, who you're about to see next. And way beyond what's unsaid in her video is that when we met her, she had no electricity. She then got a Luke light, and by studying by little Luke light, she learned enough English and other subjects to get a scholarship to the very coveted Comsa school, where Oscar's children would go because it's for the children of coffee plantation owners. And now I'll let you meet her and be equally impressed.
Hola, mi nombre es Dania. Así vivía yo cuando no tenía luz, con estas lámparas de Luke, con el proyecto de mi amiga Gisela Voss, por el apoyo de mi familia. Tenemos luz. Ahora se me hace fácil hacer mis tareas, ya que me dejan muchas. Adiós. Red, yellow, blue, cherries.
want to say thank you to Danya and her family, to Oscar and his family, to all of the people of Honduras that let us into their lives, let us into their homes. I think even those of us who haven't had the elective to travel with Jennifer and Gisela have really felt that our lives have changed by meeting them, by hearing their stories. And like Jennifer said, we've distributed over 3,000 solar lights and I think about 100 chargers through Eileen and her charging stations over the last 5 years. But we want to do more. We want to help another 1,000 Danyas. And so we're going to turn to you right now. The good news is, so our goal for today with this event is to raise enough to send 1,000 Luke lights and 200 chargers to Honduras through Jennifer and her team. They want to help more folks who have special needs. That's one of the focus of theirs that Jennifer didn't get to talk to. They want to help more students like Danya. They want to help community leaders. They want to build charging stations and really giving respect, community health and light to all of these people. So again, our goal is 1,000 lights and 200 chargers. And we're asking your help, but we're only asking your help for half of that. So Unite to Light has already raised the funds for half of this. So 500 lights and 100 chargers are already paid for. That's from our buy one, give one program. A lot of you are familiar with that. If you buy a light or a charger, you get one and then it creates a credit. So half of these lights and our chargers are already paid for, but now we're looking to you. Next slide, Kate. So we need your help. We need to raise about $10,000 and we're hoping to do that today, this week, through the month of May. There's a couple different ways that you can give. One is to scan this QR code. When you get to our donation page, you can select Global Health at checkout. Just a moment for those of you who are on Zoom, we'll also be adding the donation link in just a sec to do that. But yeah, so this is how you can help. Usually it's $10 a light. This time it's actually $5 a light, right? Because we've already covered half of the cost of these products. So your donation gets doubled, which is something I think that we all love, and we all know that a single light can be so impactful. And so in this way, really your gift is 2 lights almost. So I'm going to leave it up there for just, we'll leave it up there for just a second. Let anybody else, I know it can take a few minutes to sometimes grab our cell phones and do those QR codes. But the next thing we're going to turn to with our 5 minutes left is Q&A. So if you have any questions, use the chat. We'll just give everybody just a second to do that. And then we'll jump into our Q&A. I just left the donate in the chat. I've got a few questions that were sent ahead of time, so I think I might start with those. Let me just grab it. So one of the questions, and this is a good one. Given the current international trade climate, particularly with the new trade tariffs on imported goods, how have the policies affected the pricing and importation of lights and chargers? So as you may or may not have been following, the Trump administration put essentially so our lights and chargers are manufactured in China. They always have been. Our partners make some of the best products in the world, like the best products in the world. Electronics are made in China these days. That's just kind of how the world works. And we have amazing partners with Branford and with the SXR.
I have to do a huge shout out, for those of you that know me, to Joe and Danny Batat, who manufactured the toys I used to make in a past life, because they have for years now been manufacturing this light at no profit to them for us.
Yes, we have amazing manufacturing partners. So tariffs were put 145%, dropped down to 30%. The good news is that we had actually imported a decent amount of inventory at the end of last year, expecting there to be some uncertainty. So, the real issue is products that we would ship from the US to kind of, into the US and then ship to US or other outside partners, like the ones we were traditionally shipped to Honduras. So this year, what we're doing is really focusing in on using those supplies in country for the ones that we need to have in country. So disaster response, folks who are experiencing houselessness, and then for larger projects, really focusing on direct from Strat factory shipment. So if it's more than 1,000 lights, we can actually ship direct from our factory to our end users, which is a wonderful thing. We are keeping an eye on what's happening on the tariffs. A 30% tariff is not as hard to swallow as 145%, but it will significantly change how we do business and our pricing. You know, for years we've been able to say, oh, $10 we'll send a light anywhere in the world. And now that's not necessarily true. $10, I can send a light if I don't have to bring it to the US, but if I have to bring it to the US, then it is more than that. So many of you saw we've actually increased the prices of our lights and our chargers. And that's not just tariffs, it's also having to do with storage, cost of living, all of those things. So, you know, we've made over the years a better and better light, and our prices are going up a little bit. But again, we really are trying to maintain our pricing as much as possible. And projects like this, where we're actually doing this match donation, is one of the ways we try to keep our costs down for our partners, so that they only have to pay part of it. I'm just gonna check our. So Terrence says, "Great questions. Y'all are great." Thank you very much. Thanks, Terrence. I think we might have time for one more question. It is 6:30, but I just want to ask, I just want to turn it back to maybe Erica and Gisela for one more question I thought was really good. Were there any notable differences in the light's impact between the rural and urban settings and their challenges and infrastructures?
You want to take that, Erica?
Yeah, I just had to find my unmute button. I don't think there were as many differences as we hypothesized. And I think it has to do a lot with what Gisela shared early on, in that in the urban area, it wasn't urban in the way that we would think. So there weren't dramatic differences that I recalled seeing.
I would say that in the rural areas, they're more using, it's what they use. The differences lay in their day-to-day activities. In the rural areas, they're using this ocote dark sooty wood. In the urban areas, they're more likely to have a kerosene lamp. In the rural areas, they might have candles that they're lighting 15 minutes at a time to go outside and check on their chickens to make sure that there's no bobcat going to get them. In the urban areas, they're far more likely to have a phone and to have access to going to nursing school, right? I mean, it was more differences in how their day-to-day life was than in differences of what their lights brought them. The lights brought them the same: safety, money savings, more capacity for education, more capacity to convene, just a sense of well-being that they hadn't felt prior to that. That was the surprise to me personally. The human piece of we are all human, right? Here we are congregating with something on our laptops. We can kind of pretend see each other by the power of things that they cannot imagine having. So here, this little light that you may was bringing them together. And so I found that similarity to be more striking than any differences between them.
Yeah. The only other thing I would call out, sorry, real fast, is I do recall reading a lot more in the rural. As Gisela mentioned, they received the light and they were asked, what would you do with this? They'd never had light. So they'd said, I have no idea. And so I felt like we read that a lot more in the rural areas as well. So yeah.
I've seen an elderly woman turn it on and turn it off, turn it on and turn it off, turn it on and turn it off. Like this Martian blonde lady who happens to speak Spanish came from outer space and delivered something she'd never seen before. I mean, it really is that striking.
Yeah. Thank you. Thank you for that. That's kind of what I wanted to end with. And thank you all so much for being here today. We really are grateful for your time, for your energy, for your interest. You know, we are just like our light, we are a small and mighty team, and we really do need all of you to help us light the world. And so, you know, I'm just going to make one last call. This is for our brightness basket. We did put the QR code for we put the link for the donate in the chat. Again, check global health when you check out. Let's help those people. Let's help them connect. Let's help them learn. Let's help them laugh and find joy and be seen. And we can do that. We can do that very simply by offering them light and letting them live their lives in the ways that they choose. So thank you for being here. Thank you
Is there
so
a winner
much.
for the raffle at the beginning?
We'll do it we'll do it on Monday. We're not going to do it right now because people got a bunch of tickets and you have to whole thing. So, but there are a bunch of people that have bought tickets. So thank you to everybody who's already bought tickets. I saw some pop up in my my notes. So thank you to everybody who's already bought. Thank you to all of you who've donated now or will donate in the future. Again, this project we're going to be fundraising through the end of the month. And thank you. Thank you for lighting the world. Happy International Day of Light. We're grateful for you. Have a great evening, everyone.
Thank you all.
Luke says bye.
Mm-hmm.